Yes, there are three things. I mean, every 4 years, we have a situation where the political parties come to us and they tell us that they have us as priority and they tell us what they are going to do for us. But do they actually tell us what they are going to do for us, or do they do what we really need? So, what I want us to look at is the importance of addressing our health challenges in Ghana. And in that, you ask the basic question, what are our health challenges? So then the second thing becomes trying to illuminate the path for people to understand, be it the political parties, be it the voter, be it the listener, what our health challenges are and how these can be addressed to ensure that we have a vibrant future. And then the fact that this shouldn't be about a particular political party, but more about the need for collective action. So at the end of all this, there will be an ask so that at least the political parties having put their manifestos out, they can inculcate these into their manifestos so they can address the issues that affect us. But how are we going to do this? We are going to look at data from Ghana. And what do I mean by data from Ghana? We're going to look at data from the Ghana Statistical Service, the Ghana Democratic Health Survey. We are going to look at the Global Health Index. We're going to look at data from the holistic assessment of the Ghana Health Service, Ministry of Health Program of Works. And we are also going to look at data from an assessment of our health facilities and what they have or don't have, what's called the Health Harmonization Facilities Assessment Report. So that is where all the data we're using for this is going to be pulled from. So it's not data that is unknown to either the government, the opposition party, or ideally the general public. So those are the three things we're going to do.
Now let's start with disease burden as a country. How daunting is this burden?
Well, you see, every health system has to deal with diseases. So when I'm asked how daunting is our disease burden, I say we have a unique disease burden. And what do I mean by unique disease burden? Traditionally, countries around the Sahara, and in fact, most health systems started traditionally that way, that they had to deal with communicable disease. So in Ghana, what do we mean by communicable diseases? We mean our malarias, our typhoids, our respiratory tract infections, our viral infections, and all that, HIV, you control of them. Those that you need a vector or something like that to contrast. And then you have what we call the non-communicable diseases that start creeping in often when you start aging, generally when you go past the third decade of life, they start gradually creeping in. But what do we see in Ghana? Because we haven't managed to get rid of a lot of our communicable diseases, there's a doubling of our disease burden. So that is what we are trying to deal with. That is what our health system has to try and address. So I'll break it down this way. Let's look at something like the communicable disease. Everyone would know that malaria is something. I mean, we are talking about dengue fever now in Ghana, but everyone knows that malaria, and that's why a lot of the symptoms of dengue are similar to malaria. So a lot of people who try to self-medicate, which they shouldn't under these circumstances because of dengue, try to treat malaria. And why are they doing so? If you look at Ghana's health service data, it will tell you that 30%. So when you go to an OPD in Ghana, 1 in 3 of the people who is sitting there is there because they have malaria. And then when you go into the wards, 40% of the people who have been actually admitted and are being treated as inpatients are there because of malaria. This comes from the Ghana Health Service report of 2020. Then there is HIV. It's still there. The prevalence rate is about 1.7% of our population. So if you look at a year like 2022, you'd say that almost 350,000 Ghanaians were living with HIV or AIDS. And so when that happens, you have an issue. Then there's tuberculosis, which in most countries now is gone, but still there in Ghana. You would realize that there are about 152 cases per every 100,000 of the population. So you see, that is the first point. Do our political parties factor this in when they write their manifestos and they want to address our health issues? And why do I ask the question? Recently, we heard that medication that had been donated to Ghana by the Global Fund had been sat at Tema for over a year and wasn't being cleared. So if this is what our disease burden for communicable diseases is, you wonder how the people who were sat there while this was happening were sleeping. And so this is, and then the question I ask myself is, while they were sleeping, while these medications sat there, did the citizenry also know that this is our disease burden and that this was a scourge on our integrity as a country? So that is our communicable disease burden. But then you realize I'm giving the top line figures, but you still have the typhoid fevers, the amoebic dysenteries, the diarrhea, all still being part of our communicable disease.
And that definitely is an important point. What about the non-communicable disease burden?
Well, this is where it gets interesting. The thing about many of these non-communicable diseases, they are silent killers. Why do I say so? They never have symptoms unless you are someone who is particular about your body or goes for routine medical checkups. And that's why often you hear, oh, there was nothing wrong with him. He was just walking around. They said he had a headache or he had this. He went into the hospital and he didn't make it. And they're like, oh, gone too soon. But the point is that because of our low outpatient per capita, on average, the average Ghanaian sees a health professional once a year. Outpatient per capita is 1.13. So you have a prevalence rate of 28% of hypertension. Diabetes is about 6.3%. Then you have the cancers rearing their head, especially cervical cancer in women and prostate cancer in men. And there are all the other cancers like the breast cancers and all that. And they are also creeping in. Then you have mental health. 13% of Ghanaians are known to be living with a mental health condition. When you say it, people think that the way we have stigmatized mental health, we make it look as if, oh, anyone with a mental health problem should be walking on the streets or should be in contact. But we forget that anxiety, depression, all these things are mental health problems. And 13% of our population are living with a mental health problem. Again, you ask yourself, if we look at how our health financing goes, do these manifestos address these communicable, non-communicable
disease? Yeah.
And if they don't, why not?
Yeah, I mean, and that is a very important point. When I sit with my guests, we'll expand on that and also ask the question, if they're addressing it, what should the interventions be? We'll come to that and expand on it. But there's also an area that you touched on that coincidentally we've been dealing with on the news today, malnutrition. And I say we've been dealing with it today because an Auditor General report has actually revealed that the school feeding program at the basic level, we are feeding children with food that is weevil infested, has pebbles in it, some of them even have worms in it. The jollof rice that is being served the children at that level, they are adding color to it, so it looks richer than it actually should. Why is this such a big focus for you, and you believe any manifesto that is put out this year that you're currently drafting must address this issue of malnutrition?
Thanks, Evans. You've hit the nail right on the head. I didn't want to say hit it bullseye because of all the connotations that comes with it. But you see, when you look at nutrition in Ghana, there's a serious disconnect. We have a dual burden there as well. So we have a rising level of obesity and we have undernourished people. That is scary. That it tells you the gap between the haves and the have-nots. And I'll put a statistics out, and you'd see that our health system, as a result, is failing even the haves. But even more, the have-nots. Because the have think they are living affluently, so they are eating all the things they don't need to eat, and they are getting obese, and they are getting saddled with the non-communicable diseases. So let's look at the very vulnerable, because that is where I want to start from. According to the Ghana Statistical Service Democratic Health Survey, 18%, so 1 in 5 of children under 5 years, are stunted. That means they don't grow to their optimum level. 6% of them are wasted. Wasting means that you are actually losing the flesh you have on your body, and that is acute malnourishment. And 6% of Ghanaian children under 5 are wasted. And then when you look at it, 49% of these children under 5 from 6 months to 59 months are anemic. So if you take a child that is 5 years, on average, you take 2 children that are 5 years in Ghana, one of them is anemic. But the more serious thing is when you add, because 12% of Ghanaian children are also underweight, under 5 years are also underweight. If you add the stunted, the wasting, and the underweight, you get 46%. So there as well, 1 in 2 children are malnourished, and they are anemic as well. That's scary. Why is it scary? Because it affects their cognitive ability, it affects their immune system, and the World Bank has shown that, especially with stunted children, their earnings is 20% less over their lifetime than normal children. So if half of the children under 5 that we have now are going to have some form of malnourished implications, you should see the economic implications. And as we go along with it, one thing I would want to point out is the losses we are making as a result of not correcting our health system, and how, if we corrected it, we could plow these losses back into the health system and actually make it better. So you look at it and you ask yourself, okay, maybe those are the poor ones. But then you find out that 10% of women between 15 and 49 years are obese, and 6% of men as well. So the ones who can afford are either overeating or eating the wrong things or not exercising properly and are not healthy. But majority of our children are also very unhealthy from a feeding standpoint. And I ask myself the basic thing, for example, after 8 years of planting for food and jobs and all these things, are these the statistics that we should be seeing? And this is why, Evans, we decided that we need to put this data out for the Ghanaian to make an assessment to see if our political parties, our governments are addressing our health needs.
Yeah, and that is a very important point. So what you're saying is when the manifestos come out, as you listen to us tonight, you would have to ask yourself when you look at it, Kwame, that the statistics that you're putting out there tonight, are they even paying attention to it? Are they addressing it? Because remember, our objective this year in running our coverage is inform the electorate. So if you're not seeing the points in there, then they are not addressing a very fundamental issue of importance to you. Let's go to another very important issue to you, but again, it is to everybody that must be addressed in any proper, responsive manifesto. And it's about sanitation. It's so important. Water and sanitation. And Kwame, let me just put it in context. There was a candidate once in opposition who made it a priority in a manifesto and said to us with a target that he would make Accra the cleanest city in Africa. So then, if you were doing a health manifesto like this show, you would have said that candidate had ticked that box. That candidate we know has been in power for 7.5 years. We are nowhere near achieving that. You say this year we should assess these two parties on the same point of water and sanitation. Why is that still important?
Well, you see, availability of water is a fundamental human right. Even in war, one of the things you do and it's considered a war crime is to poison water. It's criminal to do that, even in war, when the other person is your opponent. So if you look at it and you realize that 36% of households in Ghana have access to potable drinking water, which means 64% don't.
That's a shocking statistic indeed.
Well, you see, and these are the things that worry me because these are data that our governments and opposition parties know. And that is why we decided that we were going to pick the data from Ghanaian documents. Documents that, you see, the irony is evident. These documents have been put together by organizations that are paid for with taxpayers' money. Yet the taxpayers don't know that only 36%, so 64% of households in Ghana don't have access to drinking water. The irony is that when you come to the urban areas, Accra, Kumasi, Takoradi, it goes to about 52%. When you go to the north, upper east, upper west, it drops to less than 25%.
It's even worse, yeah.
You understand me? Then 21% of households have access to improved sanitation facilities. What does that tell you? It tells you that 79% of households, so if you walk in the streets of Accra, Kumasi, 7 out of 10 people you would see who probably are very well dressed do not have access to adequate sanitation conditions. Yet they are going to vote. Why shouldn't that bother me? You understand me? And this is from the WHO and UNICEF. And that's why for a lot of the data, we put the source out so that people can go and check. 18% of Ghanaians engage in open defecation. Open defecation, they ease themselves in public. Even cats are shy to ease themselves in public. But we humans, 1 out of 5 Ghanaians is doing that. So is it then surprising that 9% of deaths in Ghana are the result of diarrheal diseases in children? So 1 in 10 children who die in Ghana died because they had a form of diarrheal disease. And you know them, the cholera, the anemic dysentery type. 1 in 10 Ghanaians die out of that. And so you look at it and you're like, gee, someone told us that he was going to make Accra the cleanest city. If these are the statistics that we are churning out based on our own data, then there's an urgent need for investment in this area. But then when you go further and you see that there is also destruction of our water bodies because there's a conclave of, I don't know how to put it, but it's an ungodly alliance between an executive that cannot enforce the law, a security service that either is unwilling or unable to enforce the law and rid ourselves of the people destroying our water and river bodies. There's a citizenry who is recalcitrant because even though they know that this is going to affect them, they are engaging in the thing. And there's the media who's just, some are talking about it, but others, is the next big thing. And we're all sitting around. Meanwhile, poisoning water bodies is a war crime. Why wouldn't I want to know how this is going to be addressed as a health emergency in any political party manifesto?
Yeah.
And it's not just telling me I'm going to address Galamsey. I want you to show me how and show how it's costed. Because we live in an era with a poor fiscal space.
And again, this is so timely because we are talking about dengue fever outbreak right now. And fundamentally, a factor of sanitation, because the mosquitoes are bred in stagnant waters. If you clean the waters and you don't have it stagnant and the environment is clean, you're possibly not going to have the mosquitoes that spread dengue fever. And so that's very, very clear indeed. And so that then is a priority for any party drafting a manifesto, or should be. And we'll see if indeed they listen in these conversations we are having. And let's spare a few seconds, very briefly, to talk about tobacco. Because we rarely talk about smoking and tobacco, but you say it must be important. Why are you isolating this as part of your health manifesto?
I'm isolating it because, yes, we've done very well when it comes to smoking in Ghana by virtue of the Public Health Act. And the FDA also has been very, very upfront when it comes to ensuring that there's no mass advertisement. But what do we see now amongst the youth? You see all these shisha joints coming up and all these tobacco things coming flavored and all that. And you realize that even though the prevalence rate is 5% in adults, they are telling us that 1 in 3 of our youth have tried these tobacco products, which means if we don't do something about it, it's going to get worse. And if you look at the economic burden, it's estimated by the American Cancer Society that it costs us $100 million because obviously we are getting the lung cancers, respiratory diseases and all that, and all these associated things due to tobacco smoking. And the other problem we have is that because of the strides we've made, it's become a hidden ill. So among the adults, they'll smoke privately rather than do it in public for you to see and counsel them about it. And so we need to get a bit intrusive. And I always go by this thing about Lee Kuan Yew. He said, look, Singapore wouldn't have gotten where they've gotten to if he hadn't been intrusive. He says he's often accused of intruding into people's private life. But if you hadn't looked into how people live, who their neighbors are, how they speak, how they ease themselves, they wouldn't have gotten where they got to. So when you are looking at health, when you see these mushrooming coming, especially in the youth, you need to get pragmatic and act. And that is why I've included it. We don't need it to become another problem.
Yeah, don't wait for it to become a big issue before you address it. And
yes,
that's
because we are too reactionary.
Yeah.
And I want us to be proactive, and that's why I added it.
Let's focus on something that we pretend to focus on, but it's still killing us in quite substantial numbers. And I'm talking about road traffic accidents. And you say it's actually a national health emergency. Why is that? The numbers are staggering, is it not?
Well, yes, because the National Road Safety Authority puts numbers out. And in 2022, for example, there were 2,500 fatalities. But they tell you that about 13,000 crashes happened in that same year. And often it takes away the breadwinner of the family. Apart from that, it causes unemployment because the people who get injured have to be taken care of. Sometimes the injuries they get are not even covered by the NHS. But more importantly, people have to take time off work to look after their neighbors.
Yeah.
So it is an economic drain. But the serious thing, Evans, is the fact that all you need to do is to go on a drive or on a walk. And suddenly, because of the carnage of our roads, if you are not careful, your life circumstances could be changed. And the truth of the matter is, you are, and everyone listening, has either been a victim, nearly been a victim, or knows a victim of what I'm talking about. But yet, we pay lip service to it. And we look at it, and you see, already the campaign has started, and then you see people showing roads that are being constructed and all that. And I tell myself, it's sacrilege that our main trunk road, Accra to Kumasi, is still single lane for majority of the paths. Yet people are showing us roads. And I'm like, are you addressing this as a public health concern? Or you're just doing it because you want people to vote for you because you constructed a road? Do you understand the health implications of poor roads? So I want to see in manifestos, and that is why I've done it as a crosshairs, So yes, this would come under your roads and all that, but you need to demonstrate how it would address the health concerns and how you are costing it. Not to be constructing roads 6 months to an election and expect us to be voting for it.
And in terms of measurable interventions, now you have 2,500 fatalities. Should we expect in the manifestos intervention spelled out that says by 2026, I want to have this to 1,500, very clearly?
Yes, a manifesto should contain smart objectives.
Yeah.
So they should be measurable, they should be achievable, they should be realistic, and they should be time-related.
Yeah.
So if I don't see that in a manifesto, the manifesto is not smart.
Okay.
And we need to move away from a manifesto that just comes to gaslight us.
Yeah.
Because it's no longer about getting our votes. It's about addressing our health needs.
And that's important. And we quickly, as we wrap up, I want to focus on something that is big, but we don't focus on it a bit in this country. Preventive care. We always wait for us to fall sick before we rush to the hospital. We rarely go to the hospital for checkups. I mean, can a manifesto even deal with that? Should it even attempt to tackle it? You said it should.
Yes, it has to, because the essence of governance, health is a public service good. The essence of any government is to keep the citizens as healthy as possible for as long as possible, and to prevent them from going into secondary, tertiary, and quaternary care, because then you become reactionary. How do you keep them healthy for as long as possible? Is by identifying the chronic diseases before they become a disease state or an epidemic or a pandemic. How do you do that? You do that by proactively screening your citizens to identify them so you can manage them on lower tariffs. It helps your national health insurance system. It helps the people, because as you go along, you go to health finance, you see that we actually pay more out of pocket to keep ourselves healthy. So if we are not addressing this and they are not telling us, like for example, in 2020, the NDC manifesto was talking about free primary health care. Then people were saying it's not doable. Today, the NHIS is telling us that their priority has to be preventative care, because that is the only way they would be able to secure their budget and make their scheme sustainable. Meanwhile, 4 years ago, the NPP were telling us it wasn't doable. These are the things I look at and I'm like, why are you trying to play ball games with us? And so preventative care should be a priority. In countries where the health systems are sustainable, preventative care and primary care has been the main driver of the health systems. And we need to see that in our manifestos. Again, costed with smart objectives, not just I'll do preventative care or I'll do free primary health care. Show us how, show us the money you're going to put into it, how are we going to measure it, and how are the citizens going to judge you by it. That's what I want to see.
And as we go through this, and shortly in the next few minutes, we'll be sitting down and expanding on this a bit more. Note, the importance of this is to say when the manifestos come, want to measure, as far as the health sector is concerned, measure what you're trying to tell us as against what should be the case, what the priority should be. Another one is maternal and child health. And as a country, Kwame, we've struggled to sustainably tackle this problem of maternal and child mortality. What is the current picture? And what commitments do you propose political parties must take to deal with this?
You see, Evans, the humanity of every society globally, is how it treats its most vulnerable. So when it comes to health, you are looking at the very young, those who bring us life because they guarantee our population growth, which then guarantees our productive economic base, and the elderly. So if you look and you realize that infant mortality is about 28 in 1,000. Out of every 1,000 lives there, 28 will die. That's too much. And the 5 mortality, out of every 1,000 lives there, 40 will die. Why? And you see, you look at our own data and it says only 47% of health facilities offer outpatient management of severe acute malnutrition. One of the reasons why the children are dying, we already looked at malnutrition, is malnutrition. Less than 50% of our health facilities offer this to the children. Why have we allowed this to happen? Is this being addressed by our political parties? And 54% of health facilities have a child and infant weighing scale. 46% can't even weigh your children. Why? Yeah. And these are the ones who guarantee the longevity of our population. So I want to see how these things would be addressed.
And Kwame, on that point, I want to go to two big issues, and then we can sit and expand on the others. And there are other key areas too, but two big issues before we wrap up and expand for the next hour or so, which is one, infrastructure problem that you believe must be big, and then we'll also then end by talking about the health insurance. But let's talk about infrastructure, health, and I want to put two together here. So the health financing and then health infrastructure. Governments have attempted to build this pool infrastructure there, but it's not linked to dealing with the doctor to patient ratio, for example, because if you expand the infrastructure, then you need to have doctors in there to manage. Why are these two issues very important? They must be addressed in the health manifesto.
Well, you've hit it right on the head. Without doctors, health professionals, nurses, pharmacists, you cannot open up a hospital. And in this era of technology, the question we need to ask ourselves, especially when our health harmonization assessment report is saying that 95% of our health facilities do not have the full complement of diagnostic equipment in consultation rooms to diagnose you. Only 5% have. So do we need to be building more brick and mortar when we don't have the health human resources to man them? Because you end up with a no-bed syndrome situation. So that's the first thing. The second thing is, are we looking at the data that the Ghana Statistical Service is sending out in the Demographic and Health Survey? Are we looking at the health harmonization data? Are we looking at the holistic assessment of the health Ghana Ministry of Health Program of Works data? If we were, what were citizens doing when someone came to tell us he was going to build 111 hospitals? Did we not know the number of doctors we had? Did we not know that from August last year to now, over 6,000 of our nurses and midwives have left to go and practice elsewhere? You see, so you ask ourselves, are we doing this because we want votes? Because some chief somewhere, a politician went there and he said, I want a hospital, so we'll give you one. But if we did a needs assessment of the requirements of that health needs assessment, of that paramount, is it a hospital they need to address their health issues? So I want to understand, if you tell me you're going to build a new hospital, what is the statistical data backing it? Where are you going to find the money from? And more importantly, how does that address the need? But in that, what do you call it? Auditor General's report tells us that with health sunk costs, infrastructure that we've started and we've been completed, we are losing 1.3 billion Ghana cedis. Are you going to complete that first? So these are the things I am looking at, and I'm like, no, this year, if you don't address this, then you don't want to have a health conversation. And I believe that as Ghanaians, we should be measuring the health manifestos that they put out against some of these things.
And let's end, Kwame, on that big subject we've been talking about last year and this year. Especially, it brought the dialysis crisis conversation, brought the national health insurance into some sharp focus. And it was just in this studio that the chief executive was with me. We're talking about it. And he talked about the funding challenges they have. And one of the proposals he's making is that uncap it, but also don't put the monies coming into the National Health Insurance Scheme into the consolidated fund. And it's a proposal that he was pushing on PM Express. What do we do with the National Health Insurance Scheme? And what should a responsive manifesto do with it?
Well, a responsive manifesto should be telling us how it's going to ensure that, for example, hospitals, pharmacies, and all providers are paid on time. Because the problem is, if you lock up their capital, you are collapsing their business and you are creating unemployment. The other thing is, it then increases the out-of-pocket payments that the Ghanaian is paying. Already, 50%, 48.5 actually, but 50% approximately, of all our health expenditure per capita comes from out-of-pocket expenditure. The government pays just around 30%, and our development partners pay the rest. So even though our health expenditure per capita has gone to $100, you are paying $50 out of it from your pocket. Meanwhile, we have a health insurance scheme. Why? Because someone in his wisdom cut the scheme and said, I have more sense than the act, and I know why we can use the money properly. And less money is going into the National Health Insurance Scheme. So I want to understand how you're going to change this. I want to understand, for example, the premiums that are being paid, because their funding stream is a bit amorphous with these premiums that are being paid by others, like people who are working and all that. Can we scrap it? Because it's become an affront to health access. And if we scrap it, how are we going to get those funds from it? I want that addressed. Because the National Health Insurance Scheme currently covers about 70% of the population, which means 30% of the population are not covered. That is unviable because it's an affront to universal health coverage, which says that finance should not be a barrier at the point of use of healthcare. So I want clearly people to be telling me, I'm going to ring fence this money as per the act. I'm going to have maybe a fund for the National Health Insurance Scheme with their own fund managers like Slate has and all those people. And they are going to make their informed decisions on how to invest these monies. They can even decide to invest it in roads and toll them and other things, so it brings them more revenue, and use some to pay. That's out to their fund managers and make this viable. So I don't want, it's now covering 70%. It's now covering 70%. What's the proportion of active users? And that is why I am highlighting the National Health Insurance Scheme, because without it, we would not achieve universal health coverage. And one thing we have to realize is universal health coverage, we signed up to achieve it in 2030. We are voting in 2024. The next government will take office in 2025. We have only 5 years to achieve it. So if serious, smart objectives are not in some of these manifestos to address the challenges that make finance a barrier, then we are joking. And that is, for me, the biggest thing for the National Health Insurance Scheme.
And